Everybody, OZZYDUDE, welcome to my first Q&A session with Moggs Stewart. Hello Moggs, how are you?
Not too bad.
High five, nice to see you. So today we're talking about Crohn's disease, which is a condition which Moggs has for most of her life. So basically the first question I'm going to ask you, I've done some research and basically what is Crohn's disease? From what I found on the NHS website, it says it's an ongoing condition that causes inflammation of the digestive tract or the GI tract. So basically part of the gut. But what's your definition?
Do you actually know what GI means?
I don't know.
Gastrointestinal.
I never knew that. I never knew that.
Basically, Crohn's disease is an autoimmune disease, so it's where your immune system attacks itself, creating ulcers in your digestive system. You can have it anywhere from the mouth all the way down to the anus, basically. I'm fortunate in the fact that mine is only radiating in my large intestine at the moment.
Oh, it's in your large intestine then?
Yeah.
So is it more commonly caused in your small intestine, or is it mostly like both sides, like large and small?
It's a funny thing, it actually goes hand in hand with something called colitis.
Okay.
Which is mainly, basically, if you have Crohn's, you've got colitis. But if you have colitis, you don't necessarily have Crohn's, which is where it depends on where the inflammation is.
Yeah.
If it's in your small intestine, you've got colitis. If it's in both, then it's Crohn's.
Okay, so listen to that. It's based on the digestive tract or the, what's the word again?
Gastrointestinal.
Thank you. So the large or small intestines, which can have effect from this actual particular condition. From what I've been reading as well, obviously there's certain causes and symptoms that vary depending on what part of the digestion which is affected. Common causes I've found is like extreme tiredness or fatigue, unattended weight loss, abdominal pain and suffering. Is that correct? Yeah. I mean, for our viewers, can you describe what other symptoms you may have experienced and what you've undergone?
Basically, because of the way Crohn's is, it's very, as it's in your intestine, it's very, very difficult to digest things. I can't digest iron very well, so people who have Crohn's also have like really bad anemia. I've had it where I've had to have blood transfusions before because I've been so anemic. But also, yeah, abdominal pain is excruciating pain. You wouldn't believe it. Tiredness is also because your body's just constantly fighting against itself.
With the iron, do you have to take iron tablets to build up your iron level in your body, or?
Personally, I should do, yeah, but I don't.
Oh, fair enough. Okay, that's no. Okay, that's fair enough. So thank you for underlining the causes and symptoms on that one. One of your questions you wrote down for me was one question in particular, which really got me, was can you die from Crohn's disease or not?
You can't die from Crohn's disease. You can die from the complications.
Okay, what are the complications?
Complications include peritonitis, which is where basically in your stomach you've got this little membrane which goes, it's almost like a sac, a thin sac that sits around your intestines. And it's called a perineum. And if that splits...
Probably perineum.
Perineum, yeah.
I've never
you
heard of that.
can contract peritonitis because it's basically what you've got is your intestines, your perineum, and then a very sterile environment.
Okay.
And obviously if one splits, you've got bacteria, loads and loads of bacteria going into a very sterile environment, and we all know what happens there, it just goes...
Right. Well, thank you for answering the complications. I mean, that's quite dark, isn't it? Really.
Yeah.
I mean, like looking from scans and that. I mean, how did you find out about that kind of stuff? Did you get told from your GP, or did you find it on the website?
About the
just like certain complications.
More
about understanding your condition a bit more.
I read it on the internet. To be fair, it used to upset me a lot when I was younger. Yeah, but actually, almost dying from complication myself, to me it's not as bad as anyone thinks. But obviously, I didn't see a choice in the matter, so I could be completely wrong.
Well, thank you for answering that question. My next one, it's a little bit different, this one. It's basically, what age were you diagnosed, from my little diary here, what age were you diagnosed with this condition, and what effect or impact did you think it had on your life when you found out? So, when you found out about your condition, what age did you find out?
I was actually 7 years old when I was diagnosed, which
wow,
is
7.
It's really rare to be that young when you're diagnosed. It's normally late teens, early 20s. Midlife sort of era, if you like.
And has it affected you much? Like when you were that young, obviously, did there have a massive effect on your family, or was it just on yourself?
It was very difficult because no one really knew much about it. Obviously, I was so young, I didn't really know much about it either. But as I've got older, I've had more of an understanding. And yeah, so yeah, I was actually diagnosed just after my dad left.
Okay.
And loads of people think that Crohn's is caused by a trauma, because your body reacts to different ways
Yeah, of
when you
course,
have a trauma.
definitely, yeah.
And mine always seemed to come out of my stomach. If I was stressed or anything, I'd have a really, really bad stomach.
So would you say, so for the viewers out there right now, would you say like it could be at any age you can get Crohn's disease then?
Pretty much, yeah.
Okay, any age. So any age, if you got any of the causes of symptoms we discussed already, have a word with your GP or actually look on the internet to understand the cause of symptoms so that, you know, yourself you might have it without realising it. So please guys, have a look.
It is also commonly disguised as IBS. People think that irritable bowel syndrome could lead to Crohn's and colitis, which many times it's not.
So don't, like IBS, irritable bowel syndrome, please do not forget the signs between the two conditions. So yeah, and one of the other questions as well is, what advice would you give to someone else who actually has Crohn's disease? So, like you said, you're an individual. Have you ever met anyone that has Crohn's disease yourself?
I have actually, yeah.
Wow.
I have, yeah. When I was in hospital, I met someone else who has Crohn's too, and we actually formed like quite a good friendship over it, and we do still talk to each other about it, even though it was like 6 years ago now.
Quite often, or do you speak
yeah,
to them?
we still speak to them. I still speak to him on a almost daily basis, really. He's always there for if we need.
So basically, you help each other. So basically, you help each other out with the small talk. And did you guys meet in hospital? Did you meet in a group, like a therapy group?
No, we met in hospital actually. When I'd gotten better and I came out of hospital, I was still seeing a psychologist to help me go through the process of what had happened. And as I was going in to see them, I met him.
Oh, okay, wow.
He had just had an operation as well, so we formed quite a good friendship after that.
Fantastic. So basically, with certain conditions in life, you can actually build special bonds with people that have the same kind of, that kind of undergoing the same kind of experience that you have. And obviously, be honest with me, did any of them actually have worse experience than you, or do you have like similar levels of it with them?
No, I would say that his experience was actually a little bit better than mine.
Okay.
Yeah, they caught his quickly and dealt with it a lot safer than what happened with me.
Okay, wow. And what keeps you going every day? Because obviously you've had this since the age of 7. What helps you fight this condition every day? What keeps you going in life?
I'm not going to lie to everyone. There are days that I have where it's like I don't want to continue, if you like. It's really, really dark days, but everyone has those days where they just don't feel like they can cope and things like that. But mine is that pure support that I have around me is fantastic. I have my friends, I have my family, and everyone around me. But I'm me. I'm crazy. I'm happy.
You're Moggs.
I am. I'm Moggs.
You're Moggs.
Definitely, I'm Moggs. And it's just amazing to think that I do have that massive support network. But it doesn't stop me from doing anything I want to do.
Okay. So it's never stopped you with like social activities you want to do. Like obviously, you're a big fan of archery, aren't you?
Yeah.
So obviously that's one of your hobbies. But that's never stopped you doing archery
I
or
even go
driving
swimming.
your car. Even go swimming.
I even go swimming.
Wow. So you can still fantastic. So
Yeah.
you've just proven to the world that there's nothing to be scared of.
No, there's nothing to be scared of. The only thing that I am quite worried about is the social side of it. Like, I'm a young female who actually has a scar and a colostomy bag, and the world doesn't like that very much. That it's not normal, if you like.
But the thing, like you said to me just a moment ago, was that you have to remember you've got great friends and family around you that support you. So remember that you've always got that.
Yeah, definitely.
Yeah, thumbs up to that, definitely. Another question I was going to ask you was, this was what I found quite interesting on the NHS website.
Yeah.
Is when you visit your GP, what is part of the initial assessment? I mean, one thing I found was MRE scans, which is like magnetic resonance, and CT scans are used to identify and examine the small intestine. Were there certain tests that you had to undergo to get your results? To identify your cause?
I actually go through, when I was diagnosed, they sent me for colonoscopies and endoscopies, which are tiny little cameras that either go up your bum or down your throat to try and determine how far the Crohn's goes. And they can take biopsies from it as well. So take
they
little
can
cells,
take biopsies.
yeah.
Oh, okay, I never
Take
knew
little
that.
cells and send them off to the lab.
Wow.
Yeah.
Wow, I never knew that. I actually didn't know about the colonoscopies, like you said. That's kind of a shock for me. I didn't know that at all.
Yeah, they use those as diagnostics.
I've got a bit of a trick question for you now.
Oh, yeah.
It's something that you thought about earlier, and I think it was it's kind of a trick question, but a silly question to ask. Are there certain food groups that you can eat when you have Crohn's, or do you eat everything like just in normal?
It really depends on what kind of person you are. Some people I know are intolerant to wheat, dairy, that sort of thing. I am lucky with the operation I had. I can now eat anything and everything. Obviously, fast food doesn't really agree with me, but it's nice to be able to eat things again. But fibre isn't a brilliant one when you've got Crohn's.
Oh, okay, so fibre. Do you think sometimes, have you stuck to a certain diet with like just different food, like having fruit, having like decent breakfast, different lunch, decent dinner?
No.
No, you haven't?
No.
Oh, okay.
I eat what I want.
Do you recommend to have a diet for this, or do you
it really depends on what kind of person you are. If you feel like, obviously, if you've been diagnosed with Crohn's and you feel like there's something not quite right with when you drink milk, don't have dairy, or try without dairy. Keep a food diary.
Keep a food diary. So yeah, if you're not sure about foods, keep a food diary, guys. Though underlines, shows you what you eat per day, like calorie wise, obviously. And you feel like if you need to, and also write some thoughts down as well. Do you think, do I need to change my food pattern? Really, doesn't it? So change the food routine, which is pretty good. Well, the other thing as well. One question. You're now age 22.
Yep.
Last year, obviously. Do you think now Crohn's disease has actually had a major effect on your social and work life at all? Do you think it's because now you've got a career in nursing, and you want to try and study a bit more in that area? Because obviously you work in private hospitals. Is that correct?
Yes,
yeah. Do you think that's had a major impact at all when you get older, or not?
When I was younger, my social life was pretty much non-existent. It got to the point where I had no friends. I couldn't go out anywhere. I couldn't go anywhere without knowing that there was a toilet there. So just before I had to have major surgery, I couldn't leave my house.
Oh really?
Yeah.
How come?
I couldn't. I was 28 kilos.
Wow.
It was about 4 stone, if you don't know that. And I was 16 at the time, and I didn't have the energy at all. I was sleeping all the time. I had to have an operation to have a tube put into my stomach to be fed overnight. It's called a peg.
Oh, okay.
So
Is it like a feeding tube kind of goes down your throat?
No, not down my throat. It went into my stomach.
Oh, into your stomach?
Yeah.
Ah, okay.
Through my stomach wall. To be fed every night because I was just losing so much weight and I couldn't eat properly. With
the weight loss, was that because you felt a little bit lonely, didn't have any much support from your point of view? Is that why? Do you think you starved yourself at all, really?
No, it wasn't that.
Was it because?
It was more the fact that I associate. It's a common thing with Crohn's sufferers, as well as other like colitis as well.
Yeah.
Weight loss is a massive issue, and I associated eating with the need to go to the toilet more often.
Okay.
So I stopped eating, thinking I would stop having to go to the toilet all the time.
Right.
Doesn't work.
Doesn't work.
No.
So on that part there, then, what would you advise people? Obviously, we talked about food groups. We talked about like the certain causes and symptoms that people undergo. What would you say to people right now, like in front of the camera?
Basically,
what would you do to help them forward, like you have yourself?
Yeah. Well, basically, if you are experiencing massive weight loss, you need to do something about it. That is another thing that can cause death. If you like, not trying to scare anyone.
Yeah. No, of course.
Yeah. I mean, I almost died from it, so it's not the best thing. But I don't know, if you are suffering from Crohn's disease yourself and you feel alone, you just remember you're not. There are people out there who understand exactly what you're going through.
Like from me, I agree what Mog says. You're never alone in this world. You always got friends and family, and if you have something on your mind or something going on, always speak to someone. Never sit on your own ever. Okay, that's one thing in the world that everyone needs to do, because there's always one person that will always listen and they will help you any way they can. Thank you for that, answering that question, Mog. That was great. Finally, this is one of the questions to be honest with you, I found this quite disturbing. It's only 3 simple words. To ask you the question: is it contagious? Like for me, the way it came across was that some people got different opinions, like you said earlier. Is it contagious?
Well, let me ask you a question.
Yeah.
What do you think when I say the word disease?
Disease, what I mean is like an infection.
Yep.
Or a virus that affects the body, so it makes your body...
things that are contagious, so like...
Yeah.
Coughs and colds and things like that.
Yeah.
Flu, yeah. Crohn's disease is not contagious, believe me. I've been told to sort out my diseases. And that was something that's always going to stick with me, to be fair. But... no, it's not contagious at all. That's just people being very shallow-minded.
Right. So, no, it's not contagious. It's not like the common cold or the flu. It is not contagious. So, thank you for answering that question.
Well, disease actually means that there is something wrong. Your body is not at ease. It's a dis-ease, not a disease that you can catch. It just means your body's not working properly.
Is that your medical knowledge coming out?
It is my medical knowledge.
Yes, your medical knowledge coming out now. There goes my 2 years worth of law degree. My final question to end this Q&A is basically certain things online I've said. There's one word I couldn't pronounce earlier. What's that saying?
Immunosuppressants.
Which are combined with other medicines that people have
Yeah.
in general life, like general routine. What treatments are there to handle Crohn's, and what treatment did you take to control or manage your Crohn's yourself?
I have been on lots of different medications for Crohn's. You can control it by diet if it works for you. It didn't work for me. So I tried what's called the liquid diet, where you just drink little shakes, 7 a day. Bearing in mind I was about 10 at the time, and it was really, really difficult. I went on a school trip and I was made to sit in the hall with people eating around me. I couldn't have any solids, no solid food whatsoever. And you have to drink 7 of these little milkshakes a day, and they were horrible, absolutely horrible. But it's just to try and give your digestive system a rest.
Oh, okay.
So there's that. Or, you, like I say, if you're intolerant to something or something sets you off in flare, then you can just try and eliminate that from your diet.
Can I just do like a rhetorical question? So was it more like your early years that you had? You had to have more of like to control that kind of thing? Was it like now, like later on, like later teens into adult years, where you managed to control it a lot better for yourself?
Mine would not control.
Oh, really?
We could not get my Crohn's under control at all until I had my life-saving operation.
Okay.
That was the only thing that controlled it.
How long ago was that?
6 years.
Wow, so 2011.
Yes, 24th of January 2011.
Wow, so almost 6 years anniversary then.
Pretty much, yeah. There's other things that control it. You can try steroids, but obviously you end up looking like a chipmunk. You actually put on so much weight.
Oh,
I used to hate them. You've got things that I've been on, like OZZYDUDE, but I didn't respond to that very well.
Yeah.
My white blood cell count dropped, so they took me off that. There's new things. They always come out with new things. You must have heard of the MAP vaccine.
I've read about it last night briefly. Something that's just been developed recently, is that correct? Yeah. Something brand new they brought into the medical field.
Yeah.
But can you explain a little bit more about
the
that
MAP
for me?
vaccine is the vaccine for Crohn's disease. So they think that if they inject this into you, it's going to stop the Crohn's.
And that's what they said at the moment. So is it in trial periods at the moment then? Or?
I think so. I think it's in its final stages of development.
Wow. So it'll be interesting to see how that process actually develops, and how if it actually has that outcome of actually curing Crohn's once and for all. Well, that's everything. Thank you for your time, for explaining, and also creating awareness about Crohn's disease. And everyone at home, thank you for watching. Like I say, thank you to Moggs for joining me. High five, nice to see you again. And guys, thank you for joining me on my first Q&A questions on lifestyles, or obviously / general life is the second half of my YouTube channel. So yeah, please subscribe to this channel, OZZYDUDE25 on YouTube. I will be adding the video later on today on Facebook, and obviously to create more awareness about Crohn's and obviously general life things which happen next couple of weeks, different things. And also, I think if you're okay with it, I might do like a live Facebook chat, maybe a week or 2 time. So we'll come back with live chat, me and Moggs, and basically we'll answer any questions that you guys have. We'll follow up on what we did this week. So yeah, guys, OZZYDUDE, subscribe. Thank you for your time. Have a pleasant evening.